Uh, let me see.
Good afternoon, everyone. This is Dr. Diane Hill, Assistant Chancellor for University Community Partnerships at Rutgers University Newark. Welcome to our first ever virtual Healthy Living series, Living Your Best Life Virtually. We are so glad that you are joining us today. Living Your Best Life Virtually is a partnership between Rutgers University Newark, Office of University Community Partnerships, Advocates for Healthy Living Initiatives, and partner organizations throughout Greater Newark and New Jersey. Over the next 5 weeks, we are partnering with you to eat, drink, and be healthy during and after COVID-19. Visit our website to learn about our Monday meditation, motivation, and music, our Wednesday wellness workshops, and our fun fitness and food Fridays. Please visit our website at oucpnewark.edu/AHLI-2020 to register, and be sure to invite your family and friends to join us each Monday, Wednesday, and Friday for an exciting menu of programs to help you to live your best life. Thank you for joining us.
Good afternoon, everyone. So glad that you're joining us again. Of course, we're in the third week of our series, and many of you have been following through with almost every session. We really thank you for joining us, and we hope you have enjoyed the sessions that we've had. We hope that you've enjoyed the wonderful music and the meditation, but we hope that you've also learned a lot about those Wellness Wednesdays, where you had the opportunity to hear from university experts that are talking about things such as COVID and understanding how it impacts your community, contact tracing, and what does that mean and what does it involve. Also, you've had the opportunity to hear from University Hospital and many of the doctors there. But today's session is about research. Today's session is a discussion with research experts. So I'd like to first say, on behalf of Nancy Cantor, our chancellor at Rutgers University Newark, I want to not only welcome you, but thank the executive team for supporting this virtual 5-week program. You're in for a treat today, because what you don't always get to see and hear about are the researchers who are really behind the scenes, who are doing a lot to put people in the community so that you learn and understand about research itself. What is research? What does it mean, research? What is the difference, research and study? Why do you need me? Why is that important? I know about some of the things that have happened in research. Can you explain to me? How do we partner as communities and universities to share the knowledge about research? So that's what today's session is, and we have a wonderful group of researchers that will be joining us. Some of them are actively involved in the community almost on a daily basis, and you're going to hear from them. So right now, I think it's important to introduce you to someone I've known for a long time. He is a member of the Advocates for Healthy Living Community Advisory Board. He's on the planning committee for this program that we're doing. But more so than that, he has been in the community and the forefront of not only being an advocate for research and how important it is, but even though everyone knows him as Francis Dixon, and they know that he is the executive director, he's been working with one of the churches in the local area, and he'll tell you more about what he's doing. But to all of us, affectionately known as Deacon Dixon in our community. And so now I'd like to introduce everyone to who I think is one of our phenomenal community leaders in the Greater Newark area. And I want to say in the great state of New Jersey, Deacon Dixon.
But God bless you, Dr. Hill. I love the way you introduced me, sis. Yes, I am so glad to be here, so glad to have all of our listeners and viewers here today, because this is going to be a great, great session. I'm excited about it. As Dr. Hill mentioned, I am a deacon. I serve at the Great New Hope Baptist Church, where Pastor Joe A. Carter is our senior pastor. And my particular job there on any given day is to serve as the executive director of our nonprofit, New Hope Now. And it's from that venue that I have the opportunity to work in the community, and that is actually over 10 years ago, as Dr. Hill mentioned, that I was united with Dr. Hill in the Outreach Community Partnership, the University Partnership, and have been working side by side with her on a number of terrific initiatives. We hosted the first Zumba class. I believe we were the first, but the longest running Zumba class at New Hope. We also did Lunch and Learns. There were other community awareness and activities that we did over the years. We focused a lot on the senior activities, but the activities all in all covered a wide breadth of the community, and it's just been a joy to work with Dr. Hill and the other members of the advisory board. What's so exciting about today's presentations is that it really starts to answer some of the questions that I've been asked so many times by some of our parishioners as well as community residents when it comes to the issue of research. Some of our clients have been approached to take part in various research surveys or programs, and they weren't always sure about the validity of the programs, what were they all about. So this is a great opportunity for a lot of great information to be shared by some awesome professionals in the field that will certainly enlighten us as to what this research issue is all about. So I'm going to have the distinct pleasure of introducing our panelists and ask them to take a minute or two to introduce themselves, their title, their organization, and share a few more words of how they feel this particular subject will be important to our community. Is that all right? Okay, we're going to start with Dr. Hudson. Dr. Hudson, would you please come to the mic, introduce yourself, and tell us a little bit more about yourself?
Sure. Thanks so much, Deacon Dixon, for hosting this panel with Diane Hill. I'm really excited to be on it. So I'm actually a professor of family medicine and community health in New Brunswick at the Rutgers Robert Wood Johnson Medical School. I am a medical sociologist by training, so a lot of the work that I do looks at how individuals interface with their primary care practices, with the healthcare system, with federally qualified healthcare centers, and looking at vulnerable populations. And so a lot of my work is in the area of cancer survivorship. I'm a member of the Cancer Institute of New Jersey. I'm also a member of the Institute for Health, Healthcare Policy, and Aging Research, which I think Dr. Dong is going to talk a bit about. And so my role actually as a faculty member is that I do a lot of research in the areas of survivorship and looking at transitions of care between getting active cancer treatment and then moving into a primary care setting. The other area that I do work in is really what we call community engaged research. And I know we're going to spend some time on the panel sort of really unpacking that concept. Right. So I also wear another hat that I've actually been involved with Diane very much on, and that's as the head of our community engagement apparatus for what's called a Clinical Translational Science Award. So New Jersey was just awarded within the last year. We're one of 60 institutions across the country that have a consortium that's between Rutgers University, New Jersey Institute of Technology, and Princeton University to do research that is focused around really moving scientific discoveries from basic science and animal models into the community and into our practices our hospitals where we see patients. So my role for the CTSA, which is called the New Jersey Alliance for Clinical Translational Science, or NJACS, is really to be the face and the person who talks a bit about how do we translate different pieces of science to communities. So I'm very excited to be on the panel today and to be talking with you about research and some of the things that we've moved forward in the past. Thank you.
Okay. Dr. Hudson, I want to thank you so much. That's a fantastic. We're going to ask now if Dr. Xin-Shi Dong would come forward, introduce himself, and tell us a little bit about you and your specialty.
Well, thank you, Deacon. This is Xin-Shi Dong. I'm delighted to be here today. I am a geriatric physician by training, and I have the privilege to direct the Institute for Healthcare Policy and Aging Research. Engaging community would be something we've been working towards for the last 20, 30 years, and trying to really understand that the voices of the communities are being heard so that we can do better research. The word research has a bit of a name to it, and the one simplistic way I like to think about it is really we think about searching again and again and researching again and again, and we search again and again, and to hope to find the balance between what's truth and what's myth. And I think that's really important, and I think making sure we have the right representation, making sure we have the right voices across different age groups, gender groups, racial, ethnic group, vulnerable population, really important, because when you look at a lot of the prescriptions and a lot of the guidelines out there really have inadequate representation. So when the vaccination comes out, when the drug comes out, our community and us asking questions, well, the people enrolled in the trial are people like me? And is it something that's going to help me? If I wasn't part of the voice, why should I enroll and participate? And I think thanks to Diane's leadership is something since I've been at Rutgers for about 2 years now, we want to continue to push towards, and making sure that our researchers do not sit in a silo, making sure our communities have a voice, that their experiences and barriers and comfort levels and building that trust and really are infused through every step of the process. And, you know, at IFH, we just undergone our 5-year strategic plan, and it's on our website, www.ifh.rutgers.edu. Really maps out where we want to be in terms of population health sciences and really leverage research to inform practice and policy. And more specifically, we have a very strong focus in many different areas, one of which is really on healthy aging. And not only given my specialty in creation of a new Center for Healthy Aging, but also we have about 10 center grants out of the entire country focused on minority aging more specifically. And we have networks not only through New Jersey, but also throughout the country as well. But I'm delighted to be here and talk with you guys and all of us trying to push this issue forward so that we can really shorten the timeline between when the research is being done to make things that really practical and meaningful, not only just for policymakers, but for the grandmas and grandpas and families in New Jersey.
No, well said, Dr. Dong. Thank you so much. That was fantastic. I want to bring to you now Sister Evelyn Fuertes, who is a great friend to not just me personally, but she has been awesome in our community. Come along, Evelyn, and tell us a little bit more about yourself.
Good afternoon, Deacon Dixon. Good afternoon, everyone. It's so great to see everyone. So my name is Evelyn Fuertes. I'm an NDTR, and I'm a community cancer control specialist at the Rutgers Cancer Institute of New Jersey. So I work on the community outreach and engagement team. And one thing that we're finding working in the community is people are hungry for information. It's definitely something that there's a need for. And to everyone else's point, our goal is to give that evidence-based information, to allay those fears, to allay the misconceptions that we hear about, to see what's going on, and just to help people be empowered to make those decisions that affect their health, because everyone should be empowered to have a say in their health care. So I'm really looking forward to being a part of this panel. Thank you so much, because I think we're going to have a lot of really, really great information today.
I'm sure of that, Evelyn. Thank you so very much. And certainly last but not least, we have Dr. Centino. Doc, would you come forward, please?
Thank you, Deacon Dixon. And thank you so much, Dr. Hill, for inviting me to be on this panel. I am very honored to be here this afternoon and share the presentation panel with Dr. Hudson and Dr. Shinshi, amazing researchers. As Deacon Dixon said, my name is Jose Centeno. It's going to be 2 years in September that I've been at Rutgers. I'm very, very excited to be at Rutgers. The reason is the energy and all the different projects that are going on regarding diversity. Particularly, my areas focus on stroke rehabilitation in an impairment, actually, that a lot of people experience after stroke that is called aphasia, which is a problem in communication, expressing or understanding. And a lot of people, different backgrounds, have stroke, experience this problem. I focused on Latinos, and my areas of expertise actually emerged from my years working at different hospitals. And I decided to go back to school for my PhD because I thought, I'm very curious about what's going on in the person's brain, but also I'm really curious about how much clinicians like me know on how to work with different minority populations. So pretty much, in addition to working on what's going on in the brain, I've been particularly focused on engaging the community and engaging researchers to work with the community so the research in stroke rehabilitation can be translated to the community and the community communicates with the researchers. So I'm very excited to be at Rutgers, and I welcome your questions later on after we keep talking about the different issues. And thank you so much, Deacon Dixon.
Well, thank you, sir. We want to welcome you all here to this afternoon. I feel as though we're going to leave here a little bit smarter today because of what you all are going to share with us. Okay, so I'm going to transition to Dr. Hill.
Yeah, thank you, Deacon. You always do such a great job of making people feel so welcome and welcoming not only in the community, but being a part of supporting the community. Thank you for that. One of the things that we know about our community is that our seniors, and that's why we're here today, we're talking about COVID-19, living your best life. And to live your best life, we need to understand, first of all, that we know that this population is very vulnerable with COVID-19. We think that's very important to understand that, because that means that the impact of the research, the impact of how research is done and what's being done will impact this community greatly. The other is that I want to talk about some things that we often talk about on the side, Deacon, and maybe you could help when you engineer this conversation. It's about, let's talk about trust. Let's talk about reciprocity. Let's talk about sustainability. And I think that we have the right mix with us here today because they get it. And it's not often that everybody gets it, but the researchers and the experts here, they get it. So I'm anxious to hear a little bit about what they say, but I just want to recognize some members of the team that I think I don't want to wait to the end. I want to do it up front. I think that it's always an honor when you have great people working with you. And I really want to just thank the other pieces of the parts of our team, Thaddeus Diggs and Tamara Horn, who are both, I hope they're on here, but I'll wave to you and say thank you and thumbs up because behind the scenes they were putting this together. But it couldn't also be put together without other members of the OUCP team. So I thank the whole OUCP family, and particularly we have a team, an IT team. It's David Edwards from IT, who is teaching and learning and taking us through this whole concept, but also his partner in crime, I call them, Yvette Ortiz-Beaumont. So, Deacon, I'm going to turn it back over to you to get to the meat of some of these questions now that we need to find out and hear from this wonderful panel of experts about what are some techniques and things that they're doing. Thank you, Deacon.
Okay. Thank you again, Dr. Hill. All right, so let's jump in here. Dr. Dung, if you would be so kind, sir, would you talk to us and tell us what exactly is research?
Sure. I think what's alluded to earlier, it's really about understanding truth. It's about searching for what's the right recipe for the right person at the right time. And I think when we think about in that context, there are different kinds of research. There are observational studies that where you follow people over time and to see how their behavior and attitudes and health change over time. And then there are experimental studies that where you conduct a intervention or a clinical trial. There are many other kind of research and evidence, but those are the two different kinds we think about. But I think most importantly that when we think about what is research, there are really steps in research that are really important. It's not just how we think about what research is, but when and how do we intervene? And I think when you look at some of the CDC guidelines in terms of stages research, is that what is the problem? What are the causes? What works? And then getting at how do we implement? How do we change? And I think those steps are really important to be able to inform our community and families to be able to search for what are the things that actually matters. I give a talk series, it's called Common Myth in Aging, where we talk about a lot of different things. Things like is olive oil healthy for you? Is red wine really good for health? Is diet soda harmless? Is intermittent fasting right thing for you? Is dark meat better than white meat? Those are things for which there are a lot of, forgive me for saying so, a bit of a biased information out there, because for the most part, only the positive, for the most part, there are more positive trials tend to be published far more than the trial that doesn't work. So I think when we hear news out there about this blip works, and we don't hear as much about the lessons could be learned from same thing that doesn't work. Diet soda, for example, red wine, dark meat versus white meat, is that there's as much as there's research evidence suggesting something is good or bad for you, there are also counter evidence that suggests that may or may not be the case. I think deciphering that are really important, and that's in part why research is important.
Right. Can you tell us a little bit about the difference between clinical research and public health research?
They are all interconnected in many ways. It's not necessarily just one or another. In many ways, many clinical research can have public health implications, and many of the public health research can be occurred in clinical setting. It really depends on what are we thinking about in terms of, primary, secondary, tertiary intervention. Are we trying to prevent something before disease and symptom occur, such as, colonoscopy or a mammogram, for example, versus someone who's had already history of colon cancer and breast cancer, and then you screen them accordingly. But I think they're interconnected in the way where we really are the questions the right question to ask. It's not necessarily a distinction between them, but rather finding the platform to connect them. But the most importantly is that are those research questions framed in a way that really have our community voices? Are they impactful? Are the findings we're going to be able to have, whether it's positive or negative, inform how we care and treat patients, how families care for their loved ones, and how social services, the aging networks, be able to take care of our aging populations.
Okay. Excellent, excellent. Now, we want to keep our emphasis on the community, and specifically with this question, why should the seniors within the community participate in research?
Yeah, having that voice, if you look at many of the drug trials, for example, they exclude older adults, in part because older adults' conditions are complex, they have more illnesses, and they're a bit unpredictable, and their immune system are not always the same as when you're younger. So I think having that voice is most important. Having that representation, it's important. But also for them to be able to have that experience to say, how does research impact me? And to help to be able to work with other members of the community and families to enroll in clinical trials, enroll in observational studies, public health research, as you talked about. I think having that voice is important. Having that representation, when you look across the country, our diet are so different, our genetic makeup is so different, people that surrounds us are very different. We simply cannot generalize something that happens in one population, say, well, that would just work for everybody else. And I think from a scientific perspective, it's really important to understand how does the mechanism differ? How does way the medicine work may be different from one group or another, unless when we don't have those adequate representation, having older adults representation is really important role in research.
Wow, that is terrific, Dr. Dong. I want to thank you so very much, sir. Dr. Hill? Oh.
Diane, you're on mute.
I'm sorry, I'm following my own rules. Make sure you mute when you're not speaking, so thanks for seeing my lips moving. I want to move to, we have Evelyn, Deacon Dixon is going to come right back to you because I'm going to move to one of our other experts that I've had the opportunity to work with, and I think it's fantastic with some things, and that's Dr. Hudson. There's a long history, Dr. Hudson, of negativity associated with clinical research studies, particularly with African Americans. You know all of the things that we heard and all of the studies that we've heard about. What are the safeguards and things that are put in place? Because I know one of the things that you do is you connect the researchers to the community. Following up with Dr. Dong and ask the question of what is research and how we look at research, can you talk a little bit about the negativities that's associated, but more than that, to go a little bit beyond, what are some of the safeguards that are put in place as you work with these researchers and some of our experts to connect them with the community?
Thanks, Diane, for that question. So, I think that particularly in the African American community and then also in our other communities of color, when we talk with people, trust is a major, major issue. And so people can sort of think about sort of more recent examples like Henrietta Lacks, whose cervical cancer cells were harvested and have been used for generations of research, and many people have benefited from it, but she and her family and her community did not immediately benefit from it. And as well, people talk about Tuskegee and, the horrible things that happened within that trial in terms of not having ethical sort of constraints put in place. And so, I think that both the National Institutes of Health as well as our universities are really focused on making sure that we don't repeat the things that happened in the past and that we don't repeat those ethical mistakes. And so we have put in place a number of different, both at the system level checks on individual researchers as well as, trainings for individuals who are engaged in research. So, for example, if you want to do research that is sponsored, you've got to go through what we call human subjects training, which is really looking at the history and better understanding what are some of the ethical issues that have happened, really understanding things like the Belmont Report and other reports that have come out that have talked about real concerns in the past in terms of the ways in which research were conducted and pointed to the problems with them, and then more importantly, pointed to solutions for that. So individuals have to be trained. Your research team has to be trained. So if you're doing, Dr. Dong talked about public health research and clinical research, if you're working with humans and participants and individuals, it doesn't matter if you're doing a survey or if you're doing interviews with somebody or if you're doing blood draws and more invasive sorts of things. All of our individuals who are working on research teams have to be trained. They have to pass training tests on a regular basis. And as well, the other piece that's sort of more systematic that's been happening as of late is that we've really been bringing in community advocates. And so what we're calling citizen scientists to really educate us not only on the questions that are important. So if I've got a treatment that I want someone to take and I want to roll that out in a study, actually talking to patients or community members to understand what are the issues that they're seeing, how are those issues manifested, and then what do we need to do to either allay fears, build trust, or address some real barriers that are there. So there's sort of two ways that, more than two ways, but the major ways in which we've really been addressing the negativity pieces have been training our researchers, training our research staff to be better and more culturally sensitive, as well as to be more ethical. We have bioethicists who are involved now in reviews of research studies, and that did not happen in the past. And then as well, we're also engaging, and that's part of what we would love to have here is if there are folks on this call who are interested, getting those community voices so that as we are coming up with study ideas that we're really thinking about not only what's interesting to us as researchers, but what's going to be helpful to you as community members. So having that dialogue and bringing people into the team. So those are some of the major things that are really have been initiated. And I'll say that yesterday I was on a call that was sponsored by the National Heart, Blood, Lung Institute that was around community engaged research and COVID. And there were 200 plus individuals on that call, and every single one of the individuals on that call talked about the importance of really making sure that whatever we do is in dialogue and in bi-directional dialogue. So you hearing me and me hearing you around what are the issues with COVID, both testing as well as vaccines. So really important that people are not only listening, but really thinking about these issues now and have put structures in place to make sure they're addressed.
Thank you so much, Dr. Hudson. I'm going to move to my friend who I think has been in our community for a while. She's worked close with she's worked close with Deacon Dixon, but we know her in the community. And we know her because she's there with a lot of programs and a lot of projects. So I would like to ask Evelyn a little bit about why is research important, and especially with minority populations? Because I know that's an area that you've been working with for a while, and you're very your face, and everybody knows you in our community. Can you talk a little bit about the importance of that?
Absolutely. So research in minority populations is important because if we don't have, and like the others have mentioned, if we don't have that population studied, then the outcomes for treatment won't be very good. So one example I like to use is heart studies that were done on men. We know when a man is having a heart attack, but because women weren't well represented in those early studies, we didn't know for a long time that the symptoms for a woman having a heart attack can be very different and missed. And those subtle symptoms, in addition to the classic, clutching an arm, are back pain and nausea, which you wouldn't think of as somebody having a heart attack. In cancer research, we have really good representation of white people of European descent. But when we look at Black or African American and Latinx representation, we're not doing as well. And there are differences between the races in the inflammatory response, and Dr. Dong mentioned that as well. We see that in certain cancers like triple-negative breast cancer, and with obesity even, in Asians, there's actually negative effects of obesity are seen at lower weights. So I would also like to add that seniors do have higher rates of cancer. So age is also a risk factor. So in addition to getting that minority population in, it's important to get that senior participation in studies as well. You know, we want minority participation, we want women, we want seniors. That's how we get that well-rounded treatment and better outcomes, because the larger sample that we have, the more variety, the better overall outcomes we can have for everyone.
Okay, all righty. I'm going to give a toss-up question for the entire panel. Can you provide examples of basic research studies and the benefit to the community? Now, Dr. Hudson and Evelyn touched on a few things there, but are there any other research studies that specifically benefit the community? And that's an open question for anyone on the panel.
Can I jump in since I just forgot to mute myself? So the Cancer Institute, we have the GRACE study, which helps eligible breast and ovarian cancer survivors get genetic testing. So the study focuses on Black, Hispanic, and women living in rural areas who are eligible for genetic testing but aren't necessarily aware of it. So in many cases, the hereditary forms of breast and ovarian cancers are more aggressive and can present in younger women. So by surveying survivors and helping them with genetic testing, they can help members of their community, members of their own families as well, screen for cancers much earlier and before getting any symptoms, which is really the goal of cancer screening. And in many cases, when you have symptoms, the cancer is more advanced and harder to treat. So that's one example from the Cancer Institute.
Okay. Thank you, Evelyn. Would any one of the other panel members like to respond to that? Can you provide examples of basic research studies that will benefit the community?
I can perhaps speak to a bit more as well. I think a lot of that, when I work with community organizations, often they need just as much data as researchers do in terms of advocating for their own needs. And I think research in many ways, as much as different kind of research, understanding the community framework through large rigorous studies can give that community or organization a voice. I'm just give you an example of a study we did in Chicago that are still ongoing, known as the PINE study. That it's involved thousands of people, and nowadays when the research was completed, now when our community organization go to Springfield, Illinois, our capital, to advocate for needs, they bring a copy of their policy brief, but they also bring a copy of the PINE report with them, saying that this is not just my singular voice and squeaky wheel gets the oil phenomena, but rather this is really speaks on behalf of our communities. And I think that's really important, and helping community organizations to be able to decipher the data points that benefits their mission and needs. And every organization have differences, and I think it's incumbent on us as researchers to be able to help the organization to say, if this is what you need, how do we get the data to support your mission moving forward?
Okay, thank you. Thank you very much, Dr. Dung. Okay, if we have no more response to that question, I'm going to pass it right back over to Dr. Hill.
Yes, and I'm going to move to one of my most recent, and I want to call him not only a colleague, but a friend. And Dr. Santana, when I met you, we talked at length about the importance of community engagement and community-engaged research. And I'd like to know a little bit more about the research, not only that you're doing, but how do we know if the research is legitimate? It's so many times that a lot of the seniors are asking us about, I'm getting paid for this, but what does it mean? Or what does it, can you talk a little bit about the protection of the IRB process? What are some basic questions that seniors should be asking even before they participate in the research? Can you expound on that a little bit for us?
Sure. Thanks so much, Dr. Hill. Well, it's very important for all research studies to pass through an IRB review. And this is a system, as Dr. Hudson and Dr. Shinshi alluded to before, that it's already in place at Rutgers and all universities, because it's a federal mandate. All studies have to go through a review that starts at the unit where the researcher is working. For instance, I work at the School of Health Professions, and there we have a grant and research officer. If all the research that we do at the School of Health Professions has to go through that office and be reviewed, and in addition, before that it goes up to another level, the larger panel within the university, the review board within the university, that includes not only the scientists, but also members of the community or individuals that are very, very familiar with the community. So for the research to be legitimate, it has to go through all of these gates to be reviewed and assessed by experts, by members of the community, by individuals who know about the community, and see if actually benefits the community is actually constructed, developed, based in a meaningful way, based on evidence, prior evidence, based on the knowledge that we have. And it actually is a good study to move forward and fair study to the community as well. And it also protects the individual in the community. Now, what kinds of questions should seniors be asking? Well, first of all, they have to ask for a description of the study in print, something that they can read in language that they can understand. They should take time to review what is called a consent form that describes all the different sides of the research, the process that has been through for review, and whether it's safe to them, how it benefits the community, all the different steps. And above all, if they have questions, please, by all means, that's your right. You should be asking about anything that concerns you about the research. So that consent form, safety, how it benefits the community, and particularly something that is very important in terms of any community, but particularly minority communities, is research that is long-lasting. It's not only that the researcher comes in, collects the numbers, does the studies, and leaves. It's research that is applied to the community, stays with the community members. It's an ongoing relationship that doesn't stop with the study, continues, because there will be more studies to refine that research. There will be more questions and needs and priorities that the community has, and it's an ongoing relationship.
Thank you so much. I'm going to turn it back over to Deacon Dixon, and I'm also going to let our audience know that if you'd like to put some questions in the chat box, please feel free. We will be winding down in the next 10 to 15 minutes so we can have a few questions if you have some out there. So I'm going to turn it back to Deacon Dixon because there are some other burning questions that I know that we have. Please unmute. Thank you. Deacon, you're still muted.
Please excuse me. Dr. Hudson, what mechanisms do researchers put in place to involve the community in the process of research, even from the beginning stages?
So there are a number of different things that researchers do. So the first thing that we do with our studies is we convene an advisory group. So it may start out that we'll talk to one or two individuals and say, can you help us? We have a topic that we're interested in doing work on. So if we're interested in working in, say, Newark and want to do work with COVID, the first person that I get on the phone with is I call Diane and I say, Diane, who do you know? Which organizations should we be working with? And who has an interest in this particular topic? And then we will convene an advisory board where we invite people to give us feedback on it and invite people to tell us, hey, you know what, you're missing somebody who is a really important voice here. And so the first piece of that is really making sure that you have strong advisory committees and advisory groups who are working in those areas. The other way that we do that is by interviewing individuals. So as I mentioned before, I'm a sociologist, and a lot of the work that I do is what we call qualitative research. And that just means that we spend our time interviewing people to understand what are the stories of your lived experience. So for my studies, I have one where we developed a website and a health coaching intervention for long-term survivors of breast, prostate, and colorectal cancer. And the first thing we did after convening the advisory group was they said, you need to talk to breast cancer survivorship groups. You need to work with Sister to Sister, who was Sister Network at the time, and really understand what's going on for African-American breast cancer survivors, and then also think about it from other perspectives. So talk to the men, talk to the prostate cancer survivor groups, and then when you get done talking to the groups and those who represent them, talk to the actual patients, talk to individuals to get their stories. So for our work, we do advisory groups. We also interview individuals. And then in addition to that, we do what we call, it's called member checking. And so we'll go back and say, okay, here's what we're seeing in our information that we're getting from folks. Is this what you would interpret? So is our interpretation actually reflective of what you were saying or what your experience was? So we usually go back and forth, and again, more bidirectional. So it's not just about you give us information and we go away, but it's we ask for information, we ask for clarification, and then we ask, what are the questions that you actually have that you want to have answered? And that may happen in the context of that study, but for many of my projects, it's been the way that you spin off new projects by actually talking to individuals and saying, okay, we found something really interesting here. May not be in the scope of the study we're doing currently, but that's the seed idea for the next one. We go for funding for that, and we make sure everybody's in the process from the beginning, the middle, to the end, and the beginning of the next study.
Yeah. Does all that, Dr. Hudson, keep the community engaged in the research?
Yeah, so, and that is the point of it, because you can't do work with groups and then expect them to welcome you back if you're not actually giving something back. So the other piece of that is, and I think Dr. Dong alluded to this earlier with the PINE study, it's not just about us writing our academic papers, it's about us providing information that's useful to either the community organizations we're working with the individual people who we're working with. So for us, we create toolkits and workbooks for our folks that we work with. We also provide data back to the organizations. So I've written grants with community organizations using some of our data to really leverage so that people see that there's a problem that needs to be addressed, and here's the resources there. So.
Yeah. Do you feel as though those that participate come away with a pretty good understanding of the research and their participation, their role that they play in?
Yeah, so I mean, the projects that we do, and again, I've been working in the New Brunswick area for the last 18 years. So I have a very long-standing relationship with a number of community-based organizations. And so they've seen our papers come out, we've written reports with them, we write together with them. And so one of the things that I think I encourage all consumers of research to look at is really ask questions about what are you going to do with this when you're done? How's it going to help my community? How's it going to help us? And how are you planning to feed this back to us? Because those are really important in terms of being able to figure out, are they here for us and are they part of us, or are they experimenting?
Okay. Dr. Hudson, thank you so very much. I'm going to pass this back over to Dr. Hill.
Yes, I have a burning question. I know we're down to the last 12 or 13 minutes, so I'm going to ask if you could answer these last couple of questions real fast in like a 2-minute so we could get to some of those questions in the chat box real fast. But Dr. Dong, you have the specialty of working with what I call the most vulnerable population, our seniors. And our seniors, they want to be involved because they feel like they're at a stage in their life where they want to help. But a lot of them just don't feel safe, don't know what to expect or how to even approach certain aspects of research. Can you just tell us in a quick, I'm sorry to make it quick, but I mean, this conversation that we're having can go on and on because it's so fruitful and for our community. But can you tell us a little bit about what precautions, what things are in place that are put in place, because you do so much with that population to make sure that the research is safe for that particular community?
Thank you, Diane. I think Dr. Santino touched on that a bit earlier. I think it depends on type of research. If we're talking about survey research, the risk, for the most part, is fairly low. It's really about asking people how they feel, how they live, what makes them age successfully, what makes them age perhaps unsuccessfully. And I think those, ask questions, read the consent forms. But I think for clinical trials, there are potentially, especially for drug trials, that does have potential risk that needs to be considered. And sometimes those risks may be something that's expected or tolerated. For example, we talked earlier, someone who was end of life wanting to have a cancer therapy trial, even though we know there's a lot of toxicity, but really coming back to what Dr. Hudson said earlier in terms of informed consent, making sure they ask the questions if there's risk for falling, dizziness, cardiovascular disease, that they really read it out and talk with their physicians and their family members and ask difficult questions. At the end of the day, just because there are risks doesn't necessarily mean someone shouldn't enroll in a research study, because the perceived benefits could be great. And weighing that benefit versus potential harm, it's really come down to fundamental ethical principles of right to self-determination.
Thank you so much for that. I want to ask Evelyn real quick. Evelyn, where does this research take place? People are asking. They're like, do I have to go somewhere special? Do I have to do, what do I do if these individuals, I see Gwen Stokes out there, I see Ruby Stoutmeyer, she's been at every session that we've had. I see Brenda Hopper, she's been at 95%. And I see one of our board members, Kelvin Roberson, out there. They're asking a key question. Where does this take place?
So to Dr. Dong's point, so since there are so many different kinds of studies, they can take in many shapes and forms. So we can have behavioral studies, treatment studies, or diagnostic studies. It really depends on the individual study. And some studies, they may come to your home, and maybe it's that survey that Dr. Dong just mentioned. In some cases, maybe they come to your home to draw some blood if there's a treatment going on. So there are many ways to gather information, including over the phone and online. I've worked with researchers that approach people at fairs or other events to answer survey questions, and they would provide a gift card as an incentive. So that's definitely, with technology now, there is such a wide range of ways to gather information that it might not necessarily mean having to go somewhere or having to go far, especially since we do have the Cancer Institute here in New Brunswick. We have the Cancer Institute here in Newark as well. So there are a lot of opportunities.
Thank you. I'm going to go to the chat. I see a question from Shirlene Crockett. Shirlene is one of our community advocates. She works at 13th Avenue School. In addition to that, she is involved with many community projects. And Shirlene is asking regarding the research in urban communities where we have learned about the high level of COVID cases. How can the research that is taking place right now help mental stability of the family members who have been lost to COVID, and the sudden impact for particularly seniors that are dealing with friends and family members? Can any of you, and I'll open it up to the panel, address that, please?
So I will say that there are a number of individuals who are interested in this particular topic. I know that, Rutgers has recently created a COVID center, and they had an overwhelming response from social scientists. So I think they had like 60 to 80 applications that came in. And they weren't all on this topic, but there are a number of faculty members who have been really sort of looking at this, particularly in psychology, sociology, public health, thinking about trying to understand sort of these issues around grieving, and even the experience of individuals who had loved ones go into the hospital and didn't have the opportunity to say goodbye. So there are a number of studies that are currently sort of, I think, getting off the ground that are moving to look at this in this space.
Thank you so much. Deacon, did you have any questions? We're winding down to the last 5 minutes. We have about 7 minutes left. Just want to give the 7-minute warning. Did you have any other questions? Because if not, I just have one. And it's about a lot of the people, I see them chatting a little bit, but there's a question around how do you share what you learn? And I think, Dr. Hudson, you kind of touched on that point. How do you share what you learn with the community and you share what you learned from the community with them. But also, they're asking about compensation. They see these big signs up in compensation. I want to open that up to the panel for anyone that would like to talk to our audience a little bit about that.
Hi, Dr. Hill. If I may, in terms of sharing the findings with the community, I think it's very important, and something that I've done is, and other researchers do, is after the research is completed, the results are shared with the community in terms of the researchers coming in and giving a talk to the community, or putting, in addition to that, putting the finding into a newsletter, a pamphlet in language, and explaining the results to the community. And it's also in terms of sharing the results in a way that the community understands the use of those results and the future implications of those results for this partnership, this ongoing partnership. Now, in terms of compensation, research involves, it's a bidirectional relationship. So, as Dr. Hudson said, the researcher and the community are working together. So the researcher in the grant has a budget to give the community organization some money to cover costs for the attendance of the participants, or perhaps give the participants also a voucher to cover the transportation or the cost of the equipment used in the research. Like some research covers for the cost of phones, cell phones, or laptops. So there is always budget within research projects to cover compensation to the participants in their research.
Thank you so much. Deacon, did you have anything? We're down to the last 5 minutes. I do have some shout outs to make before we close out, but do you have any remarks that you'd like to say?
Well, no, I think the breadth of the questions have been very thorough, and I just want to thank the presenters. Certainly that they've equipped me a lot better to respond to those folks that I serve. And I could have asked for more information or better information. I just want to thank everybody, certainly on behalf of the community, for their participation and their responses. And thank you, Dr. Hill.
Well, thank you, Deacon. You always do such a great job of welcoming people from the university into the community. So thank you today on behalf of the university for helping us to build these wonderful partnerships. But I also want to thank our panelists. They're fantastic. Come on, I know out there, give them a hand, come on. I can't hear you, but I can see some of you. And I want to also thank all of those wonderful community members that have been out there and partnering with us. Partners such as when we look at people like we're talking about, some that have followed us. I see some of our board members are out joining us again. I'm not only Kelvin, I see Pamela Kajus. I know Joan Reeves is out there with us. And I think that we have some people that have been following us through for 3 weeks. Misty Ward, Wilma Harris. I'm just so glad that you're out there and joining us. Thank you all. We are so glad to have you, and keep joining us for the following sessions. You don't want to miss this Friday. We're talking about urban gardening. We're talking about continuing to stretch and keep yourself fit. You don't want to miss next week, because if you know Mondays, those sing-along Mondays, we'll have Lisa, the one-woman band, and she plays a flute that just keeps you going. And then, of course, next week, we will have another wellness session. You will be hearing from our directors of senior services in the greater North area and talking about what they're doing and how they're taking care of their seniors. And then, of course, we'll be back again next Friday with some extra treats. And then the following Wednesday, the last Wednesday session, Deacon Dixon will be back again with Kelvin Anderson. That's going to be exciting, because not only are they talking about senior bullying, wow, they're going to talk about mental health and spiritual wellness for seniors. So you don't want to miss it. So keep joining in. We love you, we thank you, and we're here for you. Have a good day, everyone. Thank you again.
Amen. Great job.
Thank
Great
you.
job.
Thank
Great
you.
job.
Thank you so much, everyone.
Thank you. Thank you, Dr.
Thank you.
Hudson.
Thank you.
Thanks.
Thank you all. Gotta leave this, take that. Dr. Hudson, you're still there.
I'm still here. I'm trying to figure out how to leave. There we go.
You and me both.
I know, it took me forever to get out of here.
I usually get put out of places. So.
I know, same here, yes. Love meeting you, Deacon Dixon. Thank you so much.
Have a good day,
Thank you,
everyone.
Evelyn, we've got to talk, please, by at least sometime next week. The rest of this week is pretty much gone. But Evelyn, let's talk by next week for sure.
Okay.
And we thank all of our partners. We have over 25 partners. We thank you all for being there and being a part of this. Yvette will close it out.
Thank you.
Thank you.